Hey guys, it's Paulo, and this is my Cardiopulmonary Skills Assessment 3. So, my name is Paulo, going to be your student physical therapist. What we're going to be doing right now is positioning you for drainage of your right middle lobe. So what I'm going to do first is grab some of these pillows. If you could get up real quick. We don't have a wonderful bed that makes this easy. I'm just grabbing all the pillows that I possibly can. I honestly don't remember where this one went. Did I use that one? Let's see if this is enough first. Alright, so if I can have you lay down on your left side, please. Your head will be here, your hips will be down here. You're going to be at like a downward angle, the best that we can. So however you feel is easiest for you to get into that position.
You want me to get with my...
Let's see if we could add one more pillow for... Alright. Let's try rolling in.
This is just a practice?
No, this is, we're doing this.
Oh.
Try to get your head over here. My butt's in the camera. Alright, that's as close as we can get. I'm gonna put this pillow in between your legs for comfort. Now what I want you to do is try to rotate that chest so it's pointing upward just like that. Wonderful. So now I'm going to move this hair. Patient is in a declined position, allowing for drainage of the right middle lobe. From here we can either percuss or do vibration to help with the drainage. Now what we're going to be doing is the superior segment of your right lower lobe. So what I'm going to have you do is lay on your stomach, please, head on this pillow. What I could do, I could put a pillow under your feet for comfort. Are you comfortable here? Do you want a pillow under your hips?
This is fine.
This is comfortable, okay. So for the superior segment of the lower lobes, we're going to have them in prone. And for vibratory technique, what I'm going to have you do is breathe in, and when you breathe out, say ah. Are you ready? Ready and go. Wonderful. What we're going to be doing right now is a technique called pursed lip breathing. What it does is pretty much creates a little back pressure in the airways and helps keep them open. So it makes it a little easier to breathe, all right? So what I'm going to have you do is, I'm out of breath. Breathe in through your nose, roughly 2 seconds, and out with your mouth, maybe 4 seconds, give or take. So in nose, out with your mouth, and just imagine like you're smelling a cake and blowing out the candles. All right? If you could practice that a couple times, just so we know. There we go. Wonderful. All right, so now what we're going to be doing is the Heimlich type assisted cough, and what that means is I'm going to have you breathe in, and then when you're breathing out, I want you to try to cough, and I'm going to be helping by pushing onto your diaphragm right over here. All right? So what I want you to do, breathe in normally, breathe out. Now deep breath in and hold it. Look this way and cough. Wonderful. So what we may see when performing these drainage techniques is coughing and possibly some sputum, which is good. The point of these techniques is to help get rid of the mucus buildup. You can perform a lung auscultation before and after to listen to the differences in these sounds. So percussion is one of the things you could do to help with the postural drainage whenever the patient is in the desired position. So how you do it is you have a layer of clothing or a sheet over whichever area of the lung you're working with. You cup your hands and you have a rhythmic, cupping pattern over that area. Some precautions include unstable angina or arrhythmia, recent hemoptysis, non-intact skin, osteoporosis, a rib fracture or surgery over the ribs, and bronchospasm. If they do have bronchospasm, the patients might tolerate vibration more. So for vibration, you're just going to use the palm of your hands, put them over the area you're working with, and you're going to be shaking or vibrating. You can use a vest or a handheld device that some hospitals may have, and like I said, this one can sometimes be better tolerated if the people are prone to having bronchospasms. Other than that, the precautions are the same as with percussion. So one thing to consider when doing postural drainage is that some patients might not be able to tolerate all the positions. So what you want to do is monitor vitals, which include blood pressure, heart rate, or any other vital. Just make sure they stay within normal limits. And also, it is contraindicated for patients with intracranial pressure. We don't want to put more blood down that way. Other things can include a pulmonary embolism, any clotting or bleeding disorders, pleural effusion, or a recent permanent pacemaker or automatic implantable cardioverter defibrillator, AICD. So the Heimlich-assisted cough was a little hard to see because it was kind of difficult to position myself in a good way. So I put this here, so all you're doing is having them lie in a supine position, and you're going to instruct them to take a deep breath in, hold it, and cough. And when they're coughing, you're just going to be pushing up and in at the diaphragm. And that is it. Thank you.